little ones, how you doing? This is your abuela Tomasa here once more. No. Today we don't have a story to read. We don't have a special guest for when I grew up. No, but we have something really important and special for you guys. We have information that everybody needs to know. Why? Because we're in a pandemic. And you're gonna say, yeah, really? Yes, really. We still. So because Abuela Tomasa had a couple of questions and I don't know everything. I know I'm old. That's all I know. But I don't know everything. Okay. I need to ask people who know, professionals, to help us with information because there's a lot of people a little bit confused out there thinking right now, especially with COVID-19. Well, we need to bring a little information for you guys. And I want to introduce a special guest from the from Methodist Hospital. Her name is Sarah. Let me correct me if I say wrong your last name. Sarah Carmack. They're so nice. They always say that I do it right and I know it was wrong. But she's so sweet. Mijita, welcome and thank you, my dear. Thank you, Sarah, for being here today.
Hi, thank you for having me.
Okay, for you don't know, you will know in just a minute because Sarah, she is an infection prevention nurse. A long title, but that's what she is. And what they do, I don't know. I'm gonna ask her. So Sarah, tell us a little bit about what do you do as an infection prevention nurse?
So I do everything that could possibly prevent an infection. So anything in the hospitals, we want to protect our patients that are here and our staff. So anything that could possibly cause an infection in anybody, we want to make sure that everybody knows what they're doing and how to prevent that. So that might be hand hygiene, washing your hands, vaccinations, anything that could possibly cause an infection is kind of what I do.
Okay. And when can we say that the flu is an infection?
Absolutely, yes.
What about COVID-19?
Of course.
Okay, here's my question, because sometimes people say, I have a little bit of fever and the sniffles. I have COVID. Well, maybe not. How do we know? How the people will know they have it? Because some people think the symptoms are the same. I don't think they're the same, but tell me, Sarah, how would the people know about the difference?
So a lot of the viruses that are going around right now in the wintertime do act the same. So it can be hard sometimes to know what you might have, because you could still have a cold or the flu or COVID-19. So we want to make sure that you know what you're looking for. One of the biggest differences in COVID-19 from the other respiratory viruses right now is shortness of breath. So you don't typically see that with the other viruses. So really difficulty breathing and catching your breath. You feel like you just cannot breathe. Some people with asthma may have that feeling. That's kind of what it would feel like. So that's one of the biggest differences, because you could have a cough and a fever with some of the other viruses. So some of the things that you may want to look for, especially loss of taste or smell, you're not really going to experience that with some of the other viruses either. But you may have fever, a cough, you may have some gastrointestinal problems, so your stomach, you could have some nausea, some vomiting, diarrhea, things like that as well.
Okay, well, there's a lot of things that we have to keep an eye on it and don't get all stressed out because maybe it's just a strep throat. That's what I had last time. But I wasn't sure of breath, like
Right.
And when I went to the doctor, they did the test, and it was just a strep throat, a scratch in my neck. So the first thing we have to do is maybe go to the doctor, or what it would be the best thing, because if I have many of these symptoms that are so familiar, what would be the first thing to do?
Pay attention to what symptoms that you are having, and you may want to call your doctor or go to your doctor. Let them know exactly what symptoms that you're having, and they may want to run a test on you. A lot of places can do a rapid test on you to see if you do test positive for COVID. And they can also run some other tests. So we will frequently do a COVID-19 test, but we may also test for flu and strep at the same time.
Okay. Well, I have a question. Somebody told me, if I get the flu shot, I'll be okay, because I don't gonna have the flu and I don't gonna have the symptoms, and I will be just fine. Is that right? I don't know. It doesn't sound right to me because they're so different. But Sarah, you're the expert. What do you think?
So with the flu vaccine, you still can get the flu. It is not 100% effective. So each year they try to predict what flu is going to come the next year, and they make the vaccine based on that. So you still can get the flu. You probably will just have more mild symptoms than you would have had. But unfortunately, the flu vaccine does not help prevent COVID-19 infection. So you definitely could get COVID-19, a cold, strep throat, and allergies with a flu vaccine as well.
Okay, okay. You know, it usually when you're somebody at home is sick, it's really easy that everybody gets sick. Sometimes one of my grandkids get sick, then my daughters, then me, and it's like a change reaction, everybody. So this can happen with COVID. Am I right? That everybody can
Yes.
have it.
Yes, it can definitely happen with anybody that you're around. You can definitely pass COVID-19 pretty easily to each other. So it can be hard when you're living with people. But if you do have somebody in the house that is feeling bad, try to stay away from that person as much as possible. So if that person can stay in a bedroom alone, that would be the best thing to try to avoid passing it to each other. And if you're feeling bad, you may want to even wear a mask if you have to be around your other household members. But to spread it, to try not to spread it within the house, it can be pretty hard.
Yeah, especially they have just one bathroom. Everybody has to use that one. So there's
Yes.
no way. So one thing about, I totally forget about the question. Well, it will be back. This is the question that I had. So I've been here that some people doesn't show any symptoms. And when they go to do the test, they're positive. How can that be possible? They don't have any of the symptoms. And they're positive for COVID-19. How that happen, Sarah?
So that can happen pretty frequently. Some people never actually get symptoms and they never get sick. And those are the lucky ones, of course. They could just, their body is able to handle it and fight it off, but it's still there present in their body. And so that they can pass that to other people. It lives in their nose. And so as they're talking and coughing, breathing near other people, they could give it to each other. But sometimes they could not have symptoms yet and still pass it to each other. But then a few days later, they could start showing symptoms and get sick. So you can test positive before you actually start feeling sick.
Okay. One thing I hear of this family, they're my friends. Almost everybody got sick except one of the members, one of the children's. How? The children's are mute because somebody in the past say kids were mute. And I don't think the kids are immune at all. But this was kind of weird. You know, the mom, the sister, the grandparents got sick. Well, not sick, bad. That was lucky. But they got the test positive, and this little one, she was just fine. Nothing.
So,
Oh.
yeah, so kids can definitely get it, and we have seen kids with it. I'm not exactly sure why, but they don't seem to be as affected by COVID-19 as adults are. So we're fortunate with that, you know, that they don't get us sick, but they can. And some of them have been in the hospital. Some children have died. So it is still a risk that we need to be aware of, that they could get it. But they're less likely to be as sick as someone that's older.
Okay, let me tell you, I like to watch videos. You know, I'm not a TikTok fan, but I go to YouTube and there's a bunch of videos of people saying that if you do this and drink that, you will get better. You're not gonna get sick with COVID, you know, giving this kind of recipes about doing, you know, some drinks and putting stuff in your nose. That is really effective to you know, to prevent all this stuff, you know, eating, drinking, putting the stuff in your mouth. Mi abuelita, because I had abuelita myself too, she used Bixba Peru for everything. So in my family, it's like a Bixba Peru help at all. But I don't think that helps with COVID. What do you think?
There's not been any evidence to show that that would help prevent you from getting COVID. It just may help with some of the symptoms. So if you're having cough and things like that, it may help with to decrease some of those symptoms, but it's not going to prevent you from getting them. It is important though to make sure your immune system is good. So some of those drinks may not prevent you from getting it, but it will help boost your immune system so that hopefully you don't get as sick. But right now, we don't have anything that's proven to prevent a COVID-19 infection. The only thing that we know that we can do is to social distance from people. So staying more than 6 feet apart from people and wearing a mask. We know that those things do prevent you from getting it, but there's no drink or vitamins or anything that have been shown to definitely prevent you from getting sick.
Okay, you hear that, niños? You have to take care of yourself, but also listen to the experts, the people who know about this, okay? Not the TikToker person. Okay, something else. Sometimes people say, well, if I don't do the test, it will be fine because in that way I don't know. Anyway, they don't give you any medicine if you're sick. So this worries me when I hear people saying things like that, like, okay, well, I don't do the test. That means I'm not gonna get it. Ugh. So what do you think, Sarah? People should not get the test and that way they don't know and they will be just fine?
Well, of course, you could still have it, even not getting a test. The important part is if you get tested, then you know that you have it and you know that you need to prevent infection in others. So that would be the important part. It would let you know that you need to stay away from other people because you could potentially spread it to someone that you love or care about.
Okay, well, tell me something. The people now that here there's a shot, there is a vaccine. They start saying, no, I don't know what they're gonna put inside of me. Maybe that's gonna make me more sick. Maybe that doesn't gonna work. It's experiment. It's experiment. Because people is like that. They alarm me. So I know all people like myself, we're gonna get it first. You first, first responders are gonna get it first. But the people should be worried about getting the the COVID vaccine. They should be worried about like a side effects from the vaccine.
So I have had both of mine, and I will let everybody know that I did not have any side effects myself, other than just a little bit of soreness where they did the shot. It was just kind of like a flu shot. So if you've ever had one of those and you felt a little sore in your arm, that's really all that I had. Some people have reported having a fever or feeling kind of tired and run down the next day, but then it's over. So you want to think to yourself, is this one day of feeling bad better than the few weeks that you may feel really, really sick, that you may have to go into the hospital, that you could potentially die if you did get COVID-19? So this vaccine did go through all the trials that normal vaccines would go through. Coronavirus has been around for a long time. This is just a different variation. So if you remember SARS back in early 2000s, that is a form of coronavirus. So scientists have been able to study coronaviruses for a long time, and they have been working on vaccinations for it. So what they were able to do is just modify that to the proteins that are in COVID-19 to make it effective against that. So it might feel like it is rushed, but it has been studied and it has gone through all the trials that are needed. Now, millions of people have gotten the vaccine so far through the trials and through the initial releases, and there really have not been any major problems, no more than any other vaccines would have.
Wow, Sarah, thank you for letting me know about that. Well, let us everybody know. I didn't know that part about the COVID being around before in different, different way, in different forms. And it's not like this the people who create the vaccine just say, let's use this right now. Or no, they were studying. That's important information. Thank you so much, because
Yes.
many people wonder how they got the vaccine so quick, because that's their idea. They said this was too quick, have the shot already. Well, after a year here in the United States, we already had, thanks God, we have the vaccine. But many people didn't know. I didn't know. Like I say, the scientific people was already working in another way, in another form, in another form of COVID-19. And that part about the SARS, wow, you left me speechless. And that's rare on me. I always talking all the time. Sarah, thank you so much for this information. And one thing, now that we have the vaccine, so we don't have to wash our hands that for 2 minutes, we don't have to use the Germex everywhere. We don't have to clean our place. We have the vaccine. We have the vaccine. Or do we still have to do all that,
Yes. So, of course, you always have to wash your hands. That's going to prevent all infections. So it's going to prevent you from getting the cold and the flu and strep throat and all those other problems that you could have. So you want to prevent those as well. But the vaccine is not 100% effective. So you could still possibly get it, just like the flu. You could still get it and hopefully have milder symptoms than you would have if you had not had the vaccine. But also, there's not that many people that are vaccinated yet. So you still have to wear your mask and social distance because it is still out there. So until we actually get the virus under control, even with the vaccine, you're going to need to wear your mask and protect yourself and others.
Okay. Sarah, I want to thank you your time. I know you're still busy right now, taking care of all this, because we're still on a pandemic. That's something that people don't know. We still. So thank you so much for taking a few minutes and come and talk to Abuela and let us know all this information. I didn't know so many things, and I think it's important for the people to have more information. Something else that you want to add before we go?
So the most important thing to prevent yourself from getting sick, like I already said, is washing your hands. So make sure that you're washing your hands frequently, that you keep some alcohol sanitizer with you so that you can grab it real easily. So if you touch something, you want to make sure you do your hand hygiene before you touch your face, or you could end up sick with COVID-19 or any other things.
Okay. This is the only time when you put the hand sanitizers that smell like alcohol, it's the only time that it's good to smell like alcohol. Okay? It's the only time, and it's just your hands. Even when they get all in wrinkle like abuela's Tomasa hands. Okay? Sarah, again, thank you so much. This has been wonderful. It's so informative. Muchísimas gracias. I hope that we can have another conversation later on. And thank you to Methodist Hospital for giving us a little free time and have you with us, with Cazateatro y with tu abuela Tomasa. Muchas gracias. Y niños, follow the recommendations, okay? Follow the recommendation. See you next time. Muchas gracias y besos de la abuela. Kisses. Bye-bye.